My name is Rohan Samarajiva. I am the chair of LIRNEasia, which is organizing this event. We are very happy to welcome you on a weekend. We know what sacrifice this is, because otherwise you would have come directly from work. But the reason we are having it on Saturday is because we have international speakers and we had to fit it into their schedules. LIRNEasia has been working on, well, I could first say an outrageous statement that you wouldn't believe, which is we've been working on artificial intelligence since 2012. So you'll say that is not true. No, we've been working on what we used to call big data, and we've been working on machine learning from 2012. That is 14 years ago, right? The terminology in this area, the buzzwords, change all the time. So those days, big data was the word. And now it's everything that we used to do is called artificial intelligence, right? Nobody even makes distinctions between narrow AI, none of those. You just say AI. And that is the magic word that brought you here, right? So before I invite the head of our data, algorithms, and policy, one of our objectives in naming this thing was, I said, try to get a name that won't be outdated as the buzzwords change. So I think data, algorithms, and policy will is able to survive the changes in fashion. One of the objectives of we are a research organization, so what we need to do is we keep moving. We don't do the same thing over and over again. So back in 2012, when people didn't know what the hell we were talking about, we managed to get proprietary data sets. Actually, we got what we called mobile network big data, more usually call detail records that are generated when people make or receive calls for billing purposes. And we got these under non-disclosure agreements, and I can remember sitting down everybody who touched the data and lecturing them that this organization will have to close if these agreements are violated, right? I took it so seriously. So we managed to do wondrous things with it, because that is actually a wonderful data set. It tells you from where you're originating a call and to where. So, for example, you can actually take physical mobility. How many people come into Colombo, on what roads, and things of that nature you can get from it. You can talk about, we were able to talk about the load factors on the various BTS, base transceiver stations. That is, from that we could make inferences about which commercial areas or residential areas were becoming commercial areas because of the call pattern, because the peaks would be, as you would expect, in a residential area, the peaks would be in the evening. In a commercial area, the peaks would be during the day, and the weekends would be down in commercial areas, while in residential areas it would not be, and so on. So we worked with people from University of Moratuwa Transport and Logistics Management. We worked with doctors to talk about how dengue was spreading. We did all kinds of interesting things with this data set. But there are real limitations, particularly for people like me, because I had to spend a lot of time talking to lawyers. I mean, not the lawyers that we hired, but the lawyers who worked for the other side. And I'll tell you, that's a really unpleasant activity. Talking to lawyers who are trying to tick the boxes on whether we can do X or Y with data, right? Somebody was telling me that some of the output from that work was published only 2 years ago. I know why. Because I had to free up the data so that it could be mentioned that this data had been obtained in Sri Lanka. Can you imagine, about 10 years goes to get these clearances. So that's where we started. We went on to deal with satellite data, which is not subject to negotiations with lawyers. Then we went on to look at jobs data, which is, again, we had to negotiate getting access to it, and we had to go through all kinds of convolutions to break it and make it searchable. But we were able to say what kind of jobs or skills were in demand, and whether we were producing those kinds of skills. So we've been moving along, and now we are very happy that we have made a quantum jump. Not only because we are working with electricity data, but also because this time we are freeing up the data. The terminology that we are using is unlocking data. We are unlocking data so that other researchers can use it, right? All this time we would say, we can do it, but you can't, unless you sign a 15-page NDA with us, right? And we didn't allow outsiders to do that. They had to be employed by us, right? But now we are unlocking data. So that's the trajectory that we are moving in. We think this is where we should be going. And we are very happy that we were able to do that with the cooperation of the Lanka Electricity Company, LECO, and its general manager will be with us for the second session. And I think there are some wonderful insights that can be derived from it. We don't even know what the insights are. Just to give you an example, when we started with the mobile data, we didn't think about this dengue business. Because if you think about dengue, what is mobile phone? I mean, as far as I know, the mosquitoes don't carry mobile phones, right? So what has this got to do with it? No, you see, what we do is we move around the country and we infect the poor mosquitoes. Then they infect people. So our movements have a bearing on the spread of dengue. When Jaffna was completely closed off during the war, they didn't have any dengue. It's only after the war that the people in Jaffna got hammered with dengue. Because of people carrying dengue from here. Mosquitoes can't fly from Colombo to Jaffna, right? So we don't even know these things when we started. And that is my gripe with this old data protection rule about purpose specification, which I keep arguing with Ashwini about. It's a completely prehistoric, obsolete concept, right? That we don't know what these things are. But anyway, tomorrow we are going to discover some new things that we can do with electricity data, because we are going to have a full-day hackathon. Now, I'm not going to say any more on that subject. I'd like to invite Merl, Chandana, who leads our data algorithms and policy team, to explain to you what this event is about and to introduce the speakers and the panel. Merl.
Thank you, Prof. Yeah, once again, it's amazing to see on a Saturday evening, without doing any social media, that we've been able to get a room full. And that's probably because you're interested in what's the hot topic of the day. But what we have in store today is, as was previously mentioned, how do you get data to use for artificial intelligence, especially in countries like Sri Lanka? What challenges are there? What opportunities are there? How it has been done elsewhere? That's the remit of the day. So to set some context, if you've been alive for the past 2 years, you've probably heard of the term AI, and as Prof said, now this is a word that has evolved over time. It means different things for different people. And generative AI is particularly of vogue, and people seem to think that it can solve anything and everything for us. But there's also, on the other hand, unwarranted dystopian fears that AI will come and take over jobs, it will become sentient, and it will destroy humanity. We think neither of these discourses is particularly useful. We like to think of AI as another tool and technology that can help us get useful things done. And for that specific purpose, it's important to think about 3 different but concrete things about AI. So data is the heart, or like the lifeblood of AI. Anything that we do, that we term artificial intelligence, is largely based on data nowadays. And the data we need, the point we want to emphasize today, is that the data we need actually exists. It might not exist in the forms that we like, it may not be accessible, but most of the data that we need exists. But putting that data to use is not straightforward. as Professor Samarajee talked about, getting it out is not straightforward. There are all kinds of concerns. So this forum, what we are going to be talking about today is how do you practically think about putting data to use, how do you unlock that data, but more importantly, how do you put it to use into concrete applications. So 3 broad questions that we'll be talking about, like viewed from a project and concrete objective perspective, how do you start a data project and what do you need to think about? All kinds of examples you will see throughout the day in Sri Lanka, outside of Sri Lanka, and how can things go wrong? How do you do it right? And how can things go wrong? And what do you learn from how things have gone wrong? And you'll see examples of how things have gone wrong as well. And finally, how do you use that data ethically and responsibly? Especially when it comes to personal data, there are lots of concerns. Especially there are sectors which have heightened concerns like health, and we'll be talking about some of those examples as well. So these are some of our guiding questions for today. But before we get started, I want to add a little bit of more detail and color to some of the examples that Professor Samarajee talked about of our history with using data. So our data work started, like Professor Samarajee said, in 2012 with call detail records. So this is obviously like a demonstration, not actual data. This is what call detail records look like. Whenever you interact with a mobile network, there is a record that's generated for billing purposes. And that data contains valuable information. It contains information because you are connected to a tower. And if you move around the country, we can get connected to different towers, and you create a trail of your whereabouts. And when you analyze that at population level, large scale population level mobility characteristics emerge, and you can even figure things out such as people's economic activity, because how frequently do they pay their bills, how much is their bill, all kinds of things. So mobility and people's economic activity is broadly reflected, and if you put the right guardrails in place, there are all kinds of interesting things that you do, and we've done. So this is the example and the related publication that we did on dengue. We did another interesting example. This was a study done to evaluate the introduction or the efficacy of the introduction of the E3 highway from Katunayake to Colombo. We analyzed whether there was a meaningful reduction in travel time because the E3 highway was introduced, and we compared the travel time between 3 different routes. And we did determine that it saved, I think, about 20 minutes was the conclusion. And this CDR data we've had for a while. The data we have is now slightly outdated, but like there's still a lot of interest for this kind of data. So this is a study that was done 2 years ago in Togo. So this was after the COVID crisis. People were left in their homes. They had to be given assistance, social assistance, so they could survive. Machine learning on top of satellite imagery and call detail records were used to show that if you use an approach to identify people who have fallen into poverty using these methods and these data, it significantly outperforms every other method that was available for the Togo government during that time. So what you see is like how they do this is, if you're interested, so they first identify the 100 poorest villages using satellite imagery. So what satellite imagery contains is, at scale, it allows you to identify the number of buildings, the concentration of buildings, and the economic activity, the road network, all kinds of interesting spatial features will help you determine if an area is likely to be well off or not. So using satellite imagery, they identify the 100 poorest cantons, is what they call it, the equivalent of villages, and then they do a second filter. Out of the 100 poorest villages, they then use call detail records to identify who are the people who should be given these cash handouts to. So what they find is, what you see on the graph is, so on left-hand side, on like each cluster, you see what's called precision. Precision is out of the people who you have given cash handouts to, how many of them were actually under the category of poor, who met the actual criteria. So the phone-based methods, which is the method based in this study, outperform all other methods that are available, including the methods that was used. And the second graph, the right-hand graph in each of the clusters is what's called recall. The technical term is recall, but what it simply means is out of the people who had actually fallen into poverty, how many were you able to reach? What's the percentage you were able to reach? So the phone-based methods based on CDR and satellite imagery was the winner here. Interestingly, the final author of this paper is Joshua Blumenstock, who worked with us on that study containing the E3 highway. So he's collaborated with us, and this is like a landmark paper which came out 2 years ago. He's based off UC Berkeley right now, and this has gained a lot of attention. So there are still enduring use cases of this data, and as you can see, this data already exists. Satellite imagery is free. Call detail records with some negotiation maybe you could get to, even in the Sri Lankan context, and all else that's needed is you need to have a telephone and call people to actually establish whether they're actually, so some survey to validate before you train your models, that's also doable. So all of this work is doable, and we did some final work, like so this is in submission stage. We try to replicate this for Sri Lanka, and we are trying to see if we actually established that like we could identify 22 out of 25 poorest DSDs in Sri Lanka, because that's the resolution at which the data was available. This is still not out, it's under review. This is another example where how we ended up getting into language data. So as you can remember, around 2018, there were ethnic tensions. Anti-Muslim riots broke off, and Facebook was accused of not curtailing that. One of the reasons, maybe not all of the reasons, is that they didn't have enough methods to detect the discourse and the hatred that was online, because most of that was happening in local languages, Sinhala and Tamil. And Sinhala and Tamil do not have what's called computational resources, data sets, that allows you to do interesting and cool machine learning. So then what we did is we raised awareness around this issue. We advocated. We got an article published in Foreign Policy. We shook the data off Meta. I don't think they do it anymore, but we managed to do it back then. And we built what's called Corpora for local languages. So this is a 20 million plus data set of Sri Lankan words, or rather Sinhala words, and other related resources, so that people who want to do fancy AI and machine learning and natural language processing for local languages have at least a starting point. It's not nearly as good as English yet, but we are doing the legwork, and that's something we realized as well in trying to do this kind of work in Sri Lanka. Sometimes you have to build the building blocks yourself. You can't exactly stand on the shoulders of giants. Yeah, so that's something we've done, and we are continuing this work. We were building other language data sets. We have a project ongoing where we are going to do a media data set around the reporting of Sri Lankan media that will be out hopefully within the next year. Like mentioned previously, we've also used online job portal data to analyze whether the skills that are possessed by undergraduates are in line with what's demanded by employers. Is there a skill mismatch? We did it under a grant of the ADB. So yeah, we've been doing this work, building data sets and doing interesting things. And now we are about to release a new data set. The full data set will not be out for like another month and a half, but it's in its final stages. So what we are building is we are building a household electricity consumption data. This is funded by the Lacuna Fund. Interesting thing happening is people are realizing that data is often the bottleneck to do machine learning research, to get people started. So there are initiatives coming up. They are specifically funding you to build high quality data sets. So the Lacuna Fund is one of them. Lacuna is a fund, not exactly a funder. It's a collection of traditional funders coming together and pooling their money to build high-quality machine learning data sets. So what we have here is a sample of 4,000 households of LECO's customers. We get consumption data from LECO. So we have both smart meter consumption data and non-smart meter consumption data, because smart meter consumption, or rather smart meters, don't have full penetration. It's in about, I think, 10 to 15% of their households. The rest is non-smart meter data. But what we also have is just having the consumption data is not enough. How do you then explain what drives that consumption? Is it like the size of the households, the number of, another number, and the types of equipments you have? So therefore, we are doing a survey. So one of our strengths historically has been we are able to do high-quality representative surveys, and we are leveraging that skill to do 3 rounds of data collection of these households, and we are building this data set. So all kinds of, these are just a few of the modules that will be available on the data sets. There are other modules on this as well. This data set will be fully open access, well documented. We'll put starter code, we'll test some of the use cases out, and make sure this is as accessible as possible. Some of the use cases you can think of, out of many, is you could potentially detect inefficient appliances. That's one use case that you are particularly interested in. Just by using consumption data, smart meter data, can you actually detect patterns in the data which point to the existence of inefficient appliances? Can you define better tariff policy? Because there have been discussions around time of use metering, but then there are complaints that like the levels at which the tariffs are set don't lend people to actually adopt this policy. There might be an awareness issue as well, but there's a case to be made whether it's set at the right level. And there are things you could do around giving people better recommendations on how to reduce their electricity bills and consume energy so their footprint, the electricity footprint and the energy footprint is low. And they could do energy forecasting both at individual household level, building level, community and regional level, all kinds of use cases, of which these are only a few. And yeah, so those are some of the things we've done, and there will be a data hackathon tomorrow. We are playing around with the data, and we'll document what's going to happen, and it will be open source. Everything that we do will be open source on this project, and hopefully by the end of next month, everybody will have access to all of this and the documented process of how all of this came about. And thinking more broadly about Sri Lanka, so there has been a lot of interest around AI, digital transformations, data in Sri Lanka. I mean, some of these things you'd have already seen. There's a lot of hype. There's a lot of promise. There is a national AI strategy, of which some of us were involved as well. But leaving all of this aside, then we can have these grand plans, grand ambitions, sometimes substantiated, may not be substantiated, but how do you actually get this going? Because the value of digital and digital transformations comes from the insights that you can generate out of the data that you collect out of that. So some specific examples, one thing we want to highlight is that some sectors already have this data. So this is something I managed to get off the internet. This is from the ICT Agency of Sri Lanka. So there is a hospital health information information system in Sri Lanka, and they say the project is set to be transferred to the Ministry of Health in December 2024. So they claim they have 80 hospitals where this HHIMS has been implemented, 9.5 million patients registered, and around 23 million electronic health records. There are all kinds of questions before you can actually use this data. Do they have good data protection? Do they have good cyber security? Do they have privacy guarantees? What additional guarantees do you need? But at least the data exists. And as you will see, there have been use cases from elsewhere where this data has actually been used. And sometimes the question you need to ask is not if the data can be made as secure as possible, but what's the trade-off of using this data versus keeping it fully secure. And apart from specific data sets, there are at least plans or ideas of plans, as we heard over the last US elections, of putting data or digitalizing the agriculture sector. So this is still at conceptual stage. We don't even know if these things will get implemented. But again, as you'll see, people have thought about how data is the gap to bridging some of the inefficiencies and deficiencies we have in various of these sectors. Right. So yeah. So that brings us to what we have in store for today. So we'll start off with a keynote address, and then which will directly lead into a panel discussion. It's general topics and contours of the discussion, drawing from examples from many different countries. And to have that panel discussion, we have an impressive and eclectic line of panelists. So I'm going to introduce him briefly so that we can save time for conversation. First, we have Dr. Kasun Amarasinghe. So he's a senior research scientist at the Carnegie Mellon University and works in a lab attached to both the machine learning department and the Heinz School of Public Policy, very similar to Adolfo. He is also a research fellow at LIRNEasia, so we get to work with him almost on a daily basis. He was also a member of the committee which drafted the national strategy for AI that you saw in Sri Lanka, where he led the work around data. Next, we have someone representing the private sector who has been in the trenches trying to get data science work going. We have Yasith Fernando. Yasith is currently the Chief Data and Analytic Officer at Dialog Finance. He was previously the General Manager of Data and Analytics at Cargill's. He was also a part of the committee which drafted the National Strategy for AI, and he led the foundation's pillar, bringing everyone together and putting the thing together. Yasith? And finally, we have someone who thinks about how all of this can go wrong. That's not how she would phrase it. But Ashwini Natesan is a lawyer by training and is currently a tech, media, and telecom law consultant at Julius and Creasy. She also works as a consultant data protection officer at Capital Maharaja Group. She's also a research fellow at LIRNEasia, and she works on data protection, AI policy, and social media regulation. And independently, she also works in the space of right to information, online safety, and data protection as well. Ashwini. So I'm not going to spend a lot of time setting context. We all know the scope of the discussion today, so let's get right into it. So I'm going to ask Kasun to, so building on what Adolfo has already laid out, you work in a similar space. You, I think, work mainly in Sri Lanka with us and also in the United States, working with various civil society and government partners in trying to do this kind of work, in trying to put data to use. What key lessons have you learned? And maybe you could summarize that into like 3 to 4 minute opening remark.
Sure. Thanks, Merl, and thanks for having me here today. It's a pleasure to be here. I think I'll talk about using data and machine learning and AI for public benefit. And I'll try to anchor my remarks around 3 main points. The first one I want to stress on is the data that we need mostly exists today. This is reiterating what Merl mentioned earlier as well, because a lot of the government agencies and civil society organizations collect a lot of data already to keep their operations running. And these operations running, this data might not live on a nicely designed database or data warehouse. It can live in spreadsheets, it can live in reports, it can live in physical files, but that this information exists. And our team at CMU has done probably over 100 projects now across the world over the last 10 years or so. And most of them, almost all of them, were based on data that were already collected by organizations just to keep their operations running. So there's this untapped value we can really harness to improve the processes, the very processes that generated this data. I think to start doing that, though, we need to broaden our focus a little bit from, rather than thinking about how can we bring in AI, maybe think about how can we incorporate data-driven and evidence-driven decision-making in public policy or public sector. The second point I want to stress on is the importance of starting with concrete use cases, right? This is building on what Adolfo mentioned in his talk as well. It's very important to start with a clearly well-defined problem, an action that you are trying to inform, and learn through doing those projects. It's because there are so many different properties that we call abstractly desirable in this space, right? We talk about privacy and security, we talk about transparency, we talk about predictive performance, we talk about effectiveness, efficiency. All of these qualities are desirable at an abstract level when you think about AI, machine learning in a public setting. However, when you try to implement something in the real world, you quickly realize that it's sometimes not possible to achieve all of them. And there's going to be trade-offs between these abstract concepts that you have to make intentional choices on. And navigating those challenges are difficult at just having an abstract conversation, but can be possible when you actually connect it to a concrete use case. And it's when we start with those concrete use cases, we can learn from them and start building on those. The third point I want to bring up is the human element, right? The success of these algorithmic systems depend on the people who actually use them. This is extending the point that Adolfo made. We need to have an action, right? The action is typically taken by a human being. So if we don't train and empower the human beings who are using these systems properly, we can have a fancy algorithm, it can have 90% efficiency, but it's not going to result any change in the world that we expect because we have ignored the human element. So we need to think about empowering our public sector with the necessary data skills and even literacy to think about how to effectively use these tools and how to effectively procure them and think about the value of them. Yeah, I'm happy to contextualize these things with examples later on, but those are the 3 points I wanted to make.
Thank you, Kasun. I think those are excellent jump-off points for the entire conversation for us. So for the last so many minutes, we've talked about mostly examples from the public sector, and I know there are lots of you who are from the private sector as well. And some lessons are transferable, and there might be unique challenges that you find if you try to get AI or something to do with data going in the private sector. So based on your experience rather, both in your new current role and maybe from your past lives as well, what lessons do you have and what experience can you share with us in trying to get data to you for useful applications and objectives?
See, when we think of an AI-driven organization, say for example, you're a retailer, then what you're thinking is complete hyper-personalization across different modes of reaching out to a consumer, everything that the consumer would like to have based on the preferred channel would get sent. On the inventory side, again, maybe without very or limited human intervention, demand forecasting, and all of that taking place in a very seamless manner. So that's what you really think of as a complete AI-powered organization. But getting there really requires first an organization to be data-driven and being evidence-based in their decision-making, and then only that organization can get to that state of being AI-driven. What I'll do is maybe, again, for clarity, and I'll also allude to, I think, Kasun and Adolfo as well at certain points, I'll go through an example. So I touched on this scenario of hyper-personalization. Let's say in a retail environment, we are a fashion retailer or a grocery retailer, and the problem statement then in that scenario for the marketing team would be, how do we ensure that the customer experience is good so that the customer gets something relevant for them? And also, how do we keep our costs down by not carpet bombing, but only really optimizing our, say, cost of SMSs or cost of social media to only give the right people the right thing. Now, when that conversation comes up in any organization, what happens is, if you really want to have technical barriers, you'll say, we don't have a data lake, we don't have a data warehouse, so hence we can't do any of that. Or we don't have seamlessly integrated systems from somewhere to a CRM that we can't really send out the comms. It can be, put it out as a skill challenge. We don't have data scientists, hence we can't do any of that. So in my experience, I think what I'd say is all those things are myths. As in, none of these things will stop you from starting. And if you don't start becoming data-driven, you'll never get to that end state of being AI-driven. So I don't think those are reasons not to start. The start happens by, one, like Kasun said, I think defining the problem statement. So let's say if you're a grocery, what are the problem statements? Or what is that problem statement? That would be then How do we decrease our marketing expenditure, increase customer experience by personalizing and targeting the customer well? Then we have to really think about what data sources we need. Data is a byproduct of operations. I think Kasun also said operational, which will eventually, if used well, goes back into the operation. So in this scenario of a retailer, then what are the systems that are producing this data? If it's a brick and mortar business, then we are looking at a simple POS system where you as a customer, you go, cashier enters the data. If it's an e-commerce retailer, then the front end of an e-commerce system. It's very important for us to understand, I think, systems that produce this data. So we are very clear about the data sources that we have. It can be simple transactional data that are getting recorded. But we need to know what each record means. Cashier can punch when you go and buy something. The cashier can punch when you go and return something. So each line then is not just a purchase, each line is a purchase, each line is a return, and there are different types of returns also if you really go into a particular type of business. So understanding that data is important, and if you're not data-driven today, that means you will not have the understanding, and that has to get started at some point. Organizations that are not data-driven will not have data glossaries where someone can just simply take and use, which means understanding what each field means in a data table. What is a sale? What is then the column for tax? If something has gone on promotion, then is it tagged as a promotion or not? Creating that data glossary is important. Then you can get into start analyzing some data, and that analysis can just to get started, can be simple rule-based where we just, let's say, for example, we want to give an offer for coffee. I'll take coffee as an example. I think that's something Kasun likes more than data. We talk about coffee. So let's say we want to give that as an offer. Simple rule-based analysis or analytics is the start where we look at the past behavior to see whether he's bought coffee or not and to give the promo. Quality of data becomes important. We can, yes, immediately pull some data from a source system, but if master data files are not done well, let's say he's been buying coffee, so there's a SKU he's bought, but that SKU, if he's not tagged as a coffee category product, but say caffeinated beverage, or we've seen in scenarios, let's say if he's tagged as tea, we'll never catch the fact that he's bought coffee before and he's not a coffee lover in our books, although in reality he is. So these are typical problems, and if you don't get started by touching data and addressing a problem, you'll never get to understand your systems, creating the data glossaries, fixing master data, and actioning. And when you action only, then you'll realize, okay, we've come up with a campaign. Let's do some A/B testing, send some communication to people where we have used analytics, another one maybe to a place where we have not used. Then again, what it does to an organization is it gets the organization to think about creating value with data, measuring it, and improving over time. Now this, if an organization starts at some point, yes, you can improve the rule-based and get into more ML-based predictions. Systems initially can be disintegrated, but then the CRMs and everything can come, data platforms can be created, investments can be made to a complete automated scenario of an AI-driven organization. But those are, I feel it's a journey to take, but if you don't start somewhere by becoming initially data-driven, I don't think it's a journey that, or an end state that anyone will ever get to. So in simple terms, I don't think a country or an organization can be AI-driven if they're not data-driven to start with.
And I hear you echoing the same thing that Adolfo said, but slightly in different terms. There's no substitute to understanding your own data, your own processes, what the systems generate that data are, and making sure that the solutions you develop, you are fully aware of what the solution is. And it is usually the reason why, solutions that are parachuted in from elsewhere, that you don't get involved in often fail. And I saw a statistic recently that 80% of most enterprise machine learning projects all over the world that have been deployed have failed. They happen because people who are involved in the decisions usually aren't involved enough. And now moving on. So Adolfo started with a nice, clean example of containers where you don't speak about personal data, but that's usually not the case. The more consequential decisions that we have to make involve people. So when you talk about people and their data, and there are lots of concerns that you run into. So I'm going to ask Ashwini, like just to outline what concerns do you see in trying to use this data. So Sri Lanka has now a Data Protection Act, a law rather, and trying to work with all kinds of actors and organizations. What challenges do you see more broadly?
Thank you, Merl. At the outset, I must say I don't always sound like this, so pardon me for not being my best today. The first thing is, when we talk about data, as Merl said, we have to distinguish it between personal data and non-personal data. And I'm fully aware that we use data that is both personal as well as non-personal. We'll come to non-personal in a minute, but before that, when we talk about using personal data, where the personal data is identifiable to an individual, we do have to comply with what we refer to as a Personal Data Protection Act. Now, Sri Lanka also has this act which comes into force in March of 2025. Because of this act, does it mean that you no longer can use data? The answer is no. You can certainly use data, but you have to comply with the obligations set out under the Personal Data Protection Act. Many a times, I see people talk about consent. They say that if we have obtained consent, we are okay, we are able to use that data. And they are partly right, because one of the obligations for processing data is lawful processing. But that is not the only obligation. There are various other obligations, which means when you are using personal data belonging to any individual, you are using it for whatever purpose. Yes, you have to obtain consent, but even without obtaining consent, if it is for public interest, like in the examples that were shared, you're still able to process that data. But that doesn't mean that you don't have other obligations. Lawful processing, that is the basis for which you're processing, is just one of the obligations. As the Prof also mentioned, you have other obligations like purpose limitation, making sure you only use it for the purpose for which it was collected. And mentioning a purpose, you have to specifically state what is the purpose of using that particular data. And you also have the requirement of ensuring that you only retain it for a specific period. You can't go on retaining it. Once that purpose is over, you can no longer retain that. Now, these are some of the obligations. We can talk about this in great detail, but we don't have that kind of time. I, for one, believe that we have to balance between protection of data and use of data. Various times in the Personal Data Protection Act itself, they speak of public interest. But that public interest is limited to certain examples that we would understand as larger public interest, and not in all cases. At the same time, when it comes to purpose limitation, if you are processing for research purposes, you're still able to process it for a longer period of time, even after the purpose is over. But in our examples, we can't extend that. So that is certainly something we have to be mindful of when we are collecting personal data. But like I said, not all data is personal data. Even for non-personal data, there are many areas that we must be concerned about. And one is, what are the principles of data sharing between entities? Is there transparency and clarity when it comes to data sharing? And in Sri Lanka, in the study that we did for LIRNEasia on data governance, we've seen that we have a lot of policies, including data sharing. It's just that it's still in the draft form. We don't yet have it implemented. So it's not that we do not have the policies, it's just that we are looking at implementation of those. So in a nutshell, be it processing of personal data or non-personal data, it's not that lawyers want to put spokes in the wheel and say you can't use that data, but you have to keep in mind these obligations that are inherent when personal data is involved. And when non-personal data is involved, you have to consider data governance principles.
Yes. You outlined a number of things, and maybe quite a lot. So let's get specific here. And I want Kasun to maybe go through an example where those ethical tensions, where concerns of protection and the benefits of using data came up in a very sensitive setting, and walk us through how you approached the project and how you thought about those tensions, and what practical safeguards did you have in addition to regulation to make sure that personal data was used for public good, but you followed practices so that the data was secure and in right shape.
Right. Yeah. So this project, just to give you some context, Carnegie Mellon University is in Pennsylvania. So a hospital system in Pennsylvania approached us with a public health problem that we have in the United States. It is estimated that 25% of adults in the United States have some sort of liver condition. That could be something from fatty liver or all the way up to cirrhosis, right? And even though it's like estimated to have prevalence of 25%, it has gone undiagnosed. So what they want to do is, one good thing about this disease, not a good thing, but one silver lining here is that if you identify this early, you can prevent the bad thing from happening and do proactive treatment. Currently, how they identify people at risk is they wait for another disease diagnosis of another disease to come. So if you have diabetes, you get flagged for review. If you have high cholesterol, you get flagged for review. If you have hypertension, you get flagged for review. The problem with this is, like, one, you're waiting for another disease to come in. The second thing is you might be too late, even from the liver protection angle. So what the hospital system wanted to do is do population level screening. But, well, if you want to catch everybody, the best thing to do is screen everyone, right? But the hospital system, as expected, has a resource constraint. So let's say they can only perform a limited number of tests per year. How do you prioritize people in the state for testing? So that was the question that we were dealing with. So ideal use case for machine learning, we are trying to target a limited resource to get the best use out of it. We had access to electronic health records from the hospital system. That means at a person level, every time they touch the health system, maybe it's a hospital visit, it can be an outpatient clinic visit, we know when you visited the facility, what were your complaints, what were the diagnoses, were there any lab tests ordered for you, the results of those lab tests, and any diagnoses and any medical prescriptions that the doctor did. So highly sensitive health data. And the project was about, can we use this health history that we have, a very rich health history that we have about this person, to predict the likelihood of that person developing a liver condition in the future, right? So I will get to the data protection angle in a little bit, but we got access to this data, we built this model, and we compared our model's results to what they do today. We found that with the same number of testing resources, the machine learning model can find 1,000 more people who will eventually end up developing this condition. That is potentially 1,000 lives saved, 1,000 more lives saved, right? And this is only using the diagnosis data that we have. So if we count people who didn't have the liver condition diagnosed, it could be even more people, right? So I hope everybody agrees that if we can deploy this machine learning system, that's a positive social impact, right? We could be saving lives here. But as I said earlier, this is incredibly sensitive data. So you can't just like use this data willy-nilly and put it out. So, and the tension here now is we can protect privacy and security of the data and do nothing, or we could use it and save lives, right? So how do we save lives while protecting and minimizing the risk of opening up this data? We did a couple of practical things. One is there was a strict data protection, like a data sharing agreement between the hospital system and our university. The second thing is the data never left their systems. The two people that worked on the project was Professor Rai Ghani, my boss, and myself. We got access to their systems. There was a vetting process. We got access, and we only worked on those servers. And the third thing is names were anonymized, but it was not fully anonymized because we wanted to connect different data sources, so pseudo-anonymized. So it was not immediately apparent who these people were, but we needed still demographic information to do proper testing. So those were the safeguards that we put in place. And the second thing is, yes, this is performing well, the demographic data, the reason that we wanted demographic data was we wanted to see how well the machine learning system is performing for different demographic groups, right? If, again, from a privacy angle, you shouldn't be revealing that data to researchers, but if we didn't know what the demographic characteristics of people were, we wouldn't know whether the model is behaving like predictive power is low for black individuals, for instance. So this is where the tensions arise, where you have value judgments to make between the desirable properties that you want, and it's difficult to make those choices in the abstract, but you can make those choices in a concrete use case.
Yeah, so like you see, sometimes we can talk about these things in the abstract, but when you put that in stark contrast and when you see like how many number of people's lives could be saved, you need to rethink some of the principles and see with having reasonable safeguards can we put this data into use. So I'd like Adolfo to maybe chime in a little bit with some of your experience on like how do you, like maybe citing different examples, like what other things do you do maybe in different problem settings to ensure that like the use of data is done responsibly and ethically?
Okay, thank you. I just want, before answering that, I want to establish some things, because you mentioned that the container problem was a clean problem, but actually there is in every machine learning problem, it doesn't matter how abstract is the target. I mean, households or containers or products. At the end, there are some people who is or buying or acquiring or being served by the action. So you always need to check or review that the thing that you are doing is not affecting negatively some part of the population or some particular individual there. So that's very important. So the data that we have about containers is anonymized, because we don't, you can actually use that data for tracking, who is acquiring this kind of stuff or whatever. So I don't know who is and this is a very important distinction. I don't know which is the customer of who is acquiring the contents of the container, but I need to have individualized and identifiable data in order to act on them. Again, you don't know who is this particular person or who is this particular company or who is this particular government office, but you need to have a traceability and be able to identify in the data who is doing what. And again, you don't know who is who, but at least in the data you need to be able to trace it. And several of the things that I'm going to answer the question now. I think that the main problem, and just to follow what the other panelists said, if you want to help and you want to serve better, as government, one, you have the obligation to improve the lives of your citizens. And if you are not doing data in order to do so, you are not fulfilling your obligation. So I know that you need to protect the privacy of whatever, and things could be very, very bad if you're not doing that. But there is a huge tension between I'm going to sit on the data and I'm going to use it only for operational or dashboard purposes. But your obligation as government, and even as a company, is that you need to improve the life of the citizens. And if you are not using data for that purpose, you are making more wrong than right. So that's the first thing. And related to that, and this is a huge tension, is that currently all the government is divided, because before data and computers or whatever, it was very difficult to actually govern a country. All the countries are very complex, and you need to divide the purposes and the functions of the government so they can actually be in just one particular place. But that is a huge problem if you want to improve the life of the citizens beyond these simple examples that we were discussing. If you try to, Kasun was mentioning a public health problem, but it wasn't just one particular hospital. If you want to do that across the country, you need to connect data. And you need to connect the problems that you are trying to solve. And again, if you not take in account that kind of sharing of the data, even between public and private sector, you as government cannot fulfill your obligation of serving better to the people. And I think that that's where the very tension of this lies, and it's an unsolvable problem in this moment. But I just want to put the highlight that all the data that is in the CDR records, that is a private data, actually reflects data from the people living here. And if that data is sitting inside the company, and the company is just using the data for whatever purposes that are good, you need to solve the tension between how we as a government, I'm not the government, but how the government has the opportunity to help or serve better the people if they don't have access to that kind of data. And again, these are ethical things, and I'm not proposing solutions, but I just want to highlight the situation that you need to have the access to this kind of data.
Yeah, thank you for underscoring the point we keep running into, that you could have the data protect and secure and in a locker, but there are other ethical concerns of not using the data. Kasun, yes, you want to follow?
Can I add one more thing I forgot to mention earlier, is that Ashwini brought up the specifying the purposes of data, right? So let's say electronic health records, right? The specific purpose of that data was billing. Like in the US, it's just to bill the insurance company. Yeah. Well, not Sri Lanka. There's no electronic health records apparently. But so if we lock it down to that purpose, and this is a good example of like that data being used to a different purpose, but with very good social impact. So I think again, like making those value choices in the abstract rather than thinking, like putting the options on the table and comparing what are we choosing here is a little problematic in a sense, because if we say, oh no, we collected this data for operations and billing, we're not going to use it for anything else, there is a cost to that. The cost to that could be that 1,000 lives. So if we don't put the options on the table, we don't know the costs of the choices that we're making. That is where I think we need to, rather than having a restrictive regulation or legislation, it's important to think about, like, it's not picking one, but you're picking one over the other, and what other is important.
And the example of the liver condition is just one of many things that you could potentially do with the data set, because even if you allow that use case, if the restriction it is limited to that, then there may be other things that you could do, maybe even with more impact, you could see even more lives. If that's not specified, how would you go about it? Yeah, so.
Quickly comment on that. So just to clarify, it's not that, for a minute that I'm saying that data should not be used for purposes to do good. But all I'm trying to mention is that, as the law states, is one of the obligations, is that you have to specify the purpose. But of course, if you believe that the data that you're collecting is more valuable with a larger purpose being mentioned, you are certainly able to do so and still use it beyond that purpose if you mention it. See, the 3 prongs given under the Act, at least in Sri Lanka, the PDP, is that it should be specified, explicit, and legitimate. And in the examples you give me, I think all 3 can be satisfied. We are able to specify it. We can make sure that it is legitimate. It absolutely is. And it's explicit. As long as we are able to state that this is for public interest and for prevention of a disease, we can absolutely use it. And specifically, disease prevention is given as one of the bases for processing, even without consent. So if it is for prevention of a disease, by all means, do that research. And if you tell me that I'm going to wait for consent, I would say you do not always have to wait for consent. If you do have the consent, that's excellent. But even without consent, you're able to process special categories of data like health data for disease prevention or for making sure that you want to give treatment to an individual, provided that medical professional is registered and licensed in Sri Lanka. That's just what the PDP says.
It's not a data funnel if the data scientist and the lawyer don't speak to each other without even prompting. So I want to follow up with you, Ashwini. So like what you just laid out, so sometimes there are maybe misconceptions around what the data protection law entails. And so what's clear to me is that it's important to like raise awareness among various actors on like there are legitimate use cases. What seems to be restrictive might actually not be the case. So maybe like starting with awareness building and maybe like going on to like other possible interventions. What practical things do you think that you can do like in various parts of the Sri Lankan ecosystem to make sure that we continue to extract value from data, but while broadly staying with the spirit of what data protection means and actually protecting people's rights?
Sure. I think it's very, very important. And when I hear what the panelists have to say about how data can be used for good, I'm in complete agreement that, there's no point in locking up that data. But at the same time, when lawyers are brought on board, everybody thinks that we're going to speak a dozen and then just say things that you can't do. But that's not, I think, the intent and purpose of data protection law as well. The way to bridge this gap is, number one, of course, is awareness. Number two is, of course, I do believe that data scientists and lawyers have to speak to each other to break it down with real examples of saying that this is what we intend to do with the data, and there's so much good that it can happen with this data. At the same time, I don't believe that it's a zero-sum game, that if you use the data, it means it's going to be no privacy and no security. That is not the case as well. We are able to balance both, and I think that awareness and just having open communication lines like what we have today are very, very important steps.
I had another round of questions, but I also want to leave some time for Q&A, but yes, Adolfo.
Regarding to this point, I mean, I know that, I'm assuming that lawyers and data science needs to talk between each other, among each other, but also it's important that we are not involving the people who will be affected in the discussion. So if you want to solve the real problem, it's not a data scientist problem or a lawyer problem. So the people could actually decide, okay, privacy is good, but if you are going to save my life, I prefer, as you mentioned, that the people that save my life than my privacy. And again, I know that we need to be very cautious about how the things could be wrong, but many of the things that are happening right now without using data are going wrong. So you need to make the decision about how to help, and that's it.
I want to extend the same conversation to Yasith and ask how you think about like data protection in the private sector. How do you have this conversation within your organization? Sometimes if you talk to engineers who have run away from their ethics classes all their lives, how do you get that conversation started like internally, and what best practices do you have to share around data protection?
Whether it's personal data or not, I think it comes down to how we look at data. So even going back to, I think, the good, very interesting debate we were having is about the data set, right? So if you look at that data set as just some garbage that's got created through an operation, then no one will question and say, okay, why are you not really utilizing that asset for something? But if we really do look at it as an asset, then someone can question, okay, there's an asset that's out there and is not really being leveraged to help people, and by doing that, you're doing wrong. So there are two ways to look at it. Even with other data, I mean, if I take a very simple example, a lot of companies buy data from third-party, let's say, research companies. So let's say if you take an example where a research company has invested 5 million rupees to do a research, and they're selling that to different companies. Of course, they're in the business of making money, and that data is also useful for decision-making for companies, government, etc. So they've invested money. So they'll sell. Let's say I buy it for 1 million. I know the value of data from two angles. I know the value of data from how much I paid for it. I know the value of data from an angle, how much is going to be useful for me, maybe compared to someone else getting it and, let's say, using it. Now, let's say in my organization, I share it, let's say, with the two of you. And if you don't look at it from that angle, you might take it for granted and, let's say, give it to someone else free of charge. And the moment it goes out free of charge, that 5 million that the research agency now has to collect to cover the cost cannot be covered because that the data set from right today being valued at 1 million, if it goes out to the public domain, it becomes 0. So it just depends on, but sometimes if you take it very lightly, in an organization where people don't really value data, leaking that data set out, people might just take it for granted. Why? It's not even any internal data, so I'm not even stealing any company property. I'm just releasing something I got. But they may not think this is actually going to impact someone else's business. So it's a very simple example, but I think how you look at it matters a lot. Same goes for PII. Sometimes, we are very used to sharing customer data sets like a phone directory. And people have, over time, people have taken it for granted. But when you really sit down with engineers and really explain to them that, one, for you to process this data, you don't have to see PII, it can be pseudonymized. And also you have to be very conscious that, whatever you do can impact so many people in so many different ways. And I think over time, getting that realization and getting them to believe and understanding is also important as much as, let's say, an external act, which now a company will have to comply with. And also, I think companies have their own data protection policies and procedures as well, which might be even stricter than, let's say, what the government has mandated. So it's just, I think, a matter of getting people to think a bit differently compared to what they may have thought sometime back when things were not really data-driven or data was not being used to that extent.
Thank you. So now I'm going to get into questions from y'all. So I had a couple of questions ready, but I think it's more important that we at least get a few questions from the audience. So if we can pass around a couple of mics, ask questions from any of the panelists, any or all of the panelists.
Hi, I'm Sehan. I'm just wondering, especially from Dr. Kasun and Professor Alvarado, just wondering, can the AI contain algorithms for data protection itself within its algorithms? And the second aspect is, what is your experience with hallucinations or AI hallucinations? Thank you.
The first part of your question, like, can AI solve data protection? I don't think so. Because protecting data is inherently a human process, right? There are algorithmic techniques called like differential privacy, for instance, right? Like you think about opening up the data, but you do some randomization to hide the true nature of the data. But when you do that, you actually remove the data from the real process that it was generated from. So the model that was trained on that, like fake data, isn't really useful in the real world. And our goal is to improve something in the real world, right? So I think data protection isn't this elusive thing that we need to use AI to solve, at least in my opinion. I think it's cybersecurity and other disciplines who are thinking about that. And just to refer to the conversation we were having before, is like the levels of protection that we need depends on the use case. So we can, the lawyers and the data scientists and everybody can, and hopefully the people who are actually affected by the decisions will have a say in that as well. We can figure that out. The second part of your question was hallucinations. This is a term that has been used more since the advent of generative AI, right? So generative AI can hallucinate things for questions that we ask, right? Most of the models that we use are not generative AI, but those are more discriminating, right? So basically we are giving some data and the model is learning some patterns based on the data that it gives, and it gives us a prediction. If you think about a wrong prediction as a hallucination, yes, of course, sometimes the model is more wrong than it is correct. But the interesting thing here is a model can be wrong 70% of the time, but still can be very useful. Because if you do it randomly, you will be, so the model is only correct 30% of the time. But if you do it randomly, you're only correct 2% of the time, right? So you're 15 times as better than doing something randomly with the model, but the model is more wrong than correct. So that's the, but hallucinations is a problem with like generative AI, but I haven't seen, at least I haven't seen any like a real use case where generative AI is being used effectively to improve public outcomes. Yeah.
Even no, even in public policy use cases, if you use generative AI, right? So the framework that you laid out, like what is the concrete objective that you are going to use LLMs for? Then you can figure out if LLMs, if hallucination itself is a problem, how is the decision, how are you going to use the output of LLMs? Because hallucination technically is not a problem. Yeah? It's a property of how generative AI works. Yeah. So it's viewed technically, hallucination is not a problem at all. So it's a probabilistic outcome of a generative AI model. In your context, it might not make sense. It might make things up. It might lack context. It might be because why it's making things up. So the lesson there, I suppose, is like think of the generative AI use case, what it is going to inform. Is hallucination a problem? To what degree is a problem? And can you solve that? I think then, like, in concrete use cases, like when you think less in abstract and more concretely, even the hallucinations around generative AI can be overcome, and you can even decide if generative AI is the right tool for what you are doing.
Exactly, and just a quick anecdote on research that was recently done is to say when the generative AI system doesn't have any information on the question that you asked, you just preempt the answer, like add a prefix to saying, I'm not sure, but. And apparently it showed increased usage of the information that was given. I don't remember the specifics of the study, but like conveying uncertainty can be also helpful in that context.
I think we have time for one more question. Yes.
Yeah, actually, my question is more on the value of the data set. So particularly, the training of the data is based on certain parameters. So, I mean, I'll take a quick example of how you have been seated and what the information projected in the background. So, I mean, if you look at, you are not seated according to the faces that is being, I mean, I don't know whether it's intentional, but when you are training data, so those things matters. And Yasith, I believe, kind of put some light on this place, how you would look at training of data and what would be the final valuation of that data set. I'm not asking for a particular answer, but what are the parameters that we can use to kind of value this data set? So now we are going to unlock the data and make it available for the public. And in such case, what are the parameters you would look into when valuing the data set?
I mean, you want to be sort of very theoretical about it. I think certain companies have actually given it a shot at valuing data, quantifying that value. There are some methods out there, but sort of if you take a very pragmatic view, I think there are maybe two or three ways of looking at it. One, by using the data, how much uplift I can have, let's say if it's an a private organization, on revenue, on bottom line, what can I do? So that sort of gives a value to the data. If it's a churn model, let's say I can use the data for churn, then by predicting churn, how much customers I can say prevent from being churned, that can give a value to the data set. From that angle, you can look at it. In certain instances, you can look at the data. If I start selling this data out, then how much value someone will put on that data. For example, again, maybe going back to the CDR example, let's say if the telco was also in the business of selling some of that data, then how much they will sell it, or a consumer or a retail organization, if they are selling their data for research purpose, how much would they put that value? And that can give some quantifiable number to your data set. I think trying to value it helps, because then it also helps to fund other infrastructure projects. Use cases show the value, but then again, you have to invest also in data platforms, in data governance. So yes, quantifying helps. Very theoretical, certain techniques are out there. Some have tried, some have not, but at least yes, giving some value is important.
Yeah, and what we mean by unlocking is sometimes not broadly like putting everything out there for all purposes, but like how do you like make the data like useful for particular purposes? That's how do you like unlock the shackles that there might be. So I think our time is up. So I think just to recap what was discussed very briefly. So I think a key takeaway is that usually it really helps to start from within. Like people who generate the data, who understand the processes, who understand the systems need to get involved, because that's where like the real insight and the real use cases lie. And you need to start with concrete projects, because abstractly defined things can go wrong really fast. And we, especially around data governance, I think at least one conversation we need to have is around like how do you define some of these terms, and some of the things or use cases that might seem restrictive might not be. So I think there's a lot of introspection that we might need to do, and we can certainly continue this conversation, and you can come up to us and say that if you have different opinions. So thank you all the panelists.